So any leader that's going into an organization or is currently in an organization and wants to lead an integrative healthcare initiative, they first have to really understand what the gaps are in the possible goals or the mission and vision of the organization, and understand that probably leaders at the senior level aren't fully aware of what integrative healthcare is. So there's a need to have the relationship built around knowledge base. If the senior leaders don't have a full appreciation of how this is beneficial or helps them exceed in their goals, there's no buy-in to do this kind of work. And so one of the areas that integrative healthcare leader can really align and have a common language is around triple aim. So that idea of how do we increase the patient experience, how do we best look at quality of care, and the third piece, of course, is cost, which is an element that integrative healthcare leaders have to be aware of. The cost of care, in some organizations, this will be an additional cost. So again, what is the return on investment? What's the value to an organization overall to actually do integrative healthcare? So I think for any leader that wants to do this, they have to be clear about what their personal expectations are in leading this initiative. And in some ways, they have to step outside of that expectation and really look at the overall organization's needs, from the leaders to the payers to the community to really all the key constituents that they need to align with. There is a challenge in language sometimes. Integrative healthcare has a certain language that doesn't necessarily resonate in the business or operations of a healthcare organization. So it's important that the integrative healthcare leader thinks about the language that they use in order to have good outcomes in the integration process. The work of integrative healthcare is not just about how we care for patients differently or improve the quality of care for patients. It's actually about the culture. It's about the healthcare providers, the administrators. Integrative healthcare is as much about care as it is about culture. And involving that component is really crucial to its success and its full integration.